Welcome back to another episode of HealthCap Weekly Wrap. Today, we're diving into some big developments that impact pharmacy services, quality measures, emergency preparedness, and so much more across senior living communities. First up, we've got a story that could be a real game changer for how we deliver care in long-term settings.
So, did you see that recent article in McKnight's about the new bill that could expand pharmacist roles?
Yeah, I did. It's all about the Ensuring Community Access to Pharmacist Services Act, or ECAPS. If this passes, it would officially recognize pharmacists as healthcare providers under Medicare. That means they could get reimbursed for a broader range of services in long-term care communities.
Right now, in most senior living settings, pharmacists are already doing way more than just filling prescriptions. They're helping manage chronic conditions, reviewing medication regimens, even administering vaccines, but they can't bill for most of it.
Exactly. And that's what the McKnight's piece really emphasized. This bill could finally let pharmacists bill Medicare Part B for things like medication management and test-to-treat programs. That would be a huge step forward.
And it's got major support. Organizations like ASCP, NASL, and the American Pharmacists Association are backing it because they see pharmacists as essential members of the care team, especially in post-acute and senior care.
The implications are big. More support from pharmacists means more oversight on meds, better chronic care, and probably fewer hospital readmissions. It's a win-win for residents and staff.
And for communities dealing with staffing shortages, this opens up clinical bandwidth. If pharmacists can bill for these services, they can step in to help manage care loads without stretching nursing teams even thinner.
Exactly. Plus, reimbursed services mean these roles become more sustainable. You're not just asking pharmacists to help, you're actually building them into the care model.
It's smart care, and it's about time. If ECAPS passes, it could reshape how interdisciplinary teams work in senior living. And it's a shift we really need.
Definitely something we'll be watching closely.
All right, so let's shift gears a bit. There was a really important guest column in McKnight's Senior Living this week that's calling on the assisted living industry to get ahead of the curve when it comes to quality measures.
Yeah, that one really struck a chord. The author makes the case that assisted living needs to be proactive in defining and tracking quality, or risk having it defined for us by federal regulators.
Exactly. Right now, there's no standardized national system for measuring quality in assisted living. And according to the column, that's both a vulnerability and an opportunity.
Because here's the thing, regulations for skilled nursing have gotten more intense over the years, and there's a sense that assisted living might be next. If we don't start shaping our own standards, someone else, maybe CMS, is going to do it for us.
And probably not in a way that understands the nuances of assisted living. That's the risk. The author in McKnight's really pushes the idea that now is the time to lead, not react.
And honestly, she's right. We've got a chance to set meaningful, person-centered metrics. Things like resident satisfaction, staffing consistency, engagement levels, not just clinical outcomes.
And it's not just about compliance either. It's about improving the day-to-day experience for residents. If we define quality in a way that truly reflects what matters in our communities, we can build a more sustainable model.
Plus, if you're already doing great work, and a lot of providers are, why not measure it and show it off? It can help with referrals, hiring, and even team morale.
Exactly. And the column really frames it as a call to action. We don't have to wait for a crisis or a mandate to start being transparent about quality. We can own the conversation.
And in doing that, we build trust with families, with partners, and with the broader healthcare system.
So if you haven't read it yet, definitely check out the guest column in McKnight's Senior Living. It's a powerful reminder that proactive leadership starts with accountability.
So, continuing our focus on quality, PharMerica held a really valuable webinar a couple months ago that's still incredibly relevant now that the 2025 changes are officially here.
Yeah, the one led by Leah Klusch. It was all about the new quality measures and survey updates that just took effect. And honestly, it should be required viewing for anyone in clinical or operational leadership.
Absolutely. Leah laid out how the quality measure database has been updated and what that means for how surveyors are evaluating communities. It's not just about outcomes anymore, it's about how you're getting those outcomes, how you're documenting them, and how your team communicates throughout.
Exactly. Surveyors are being trained to dig into your processes, how you assess residents, how you manage risk, and how well your team documents care delivery. That means everyone needs to be aligned, from floor staff to leadership.
And PharMerica's Illuminate platform shared tools and strategies to help teams get survey ready. It's not just about compliance. It's about using your data to drive better care and tell your story with confidence.
What really stood out to me was Leah's point that preparation has to be continuous. You can't just train once and move on. These new expectations require consistent reinforcement and cross-department collaboration.
And with staffing still a major challenge, building efficient, well-documented systems is critical. It's about creating a culture where everyone understands quality, not just a few people in the front office.
Exactly. The big message from the webinar, these changes aren't meant to punish, they're meant to raise the bar. If you're ready, they're a chance to stand out and show how deeply you care for your residents.
And if you missed the webinar, it's still available on PharMerica's website. Just look for success strategies for new quality measures and survey changes. Definitely worth your time.
So this next story, out of McKnight's long-term care news, raises some pretty serious concerns, especially for communities focused on emergency preparedness.
Yeah, the article highlights a recent report from the Office of Inspector General, and it found that over a quarter of state survey agencies don't have staff with adequate expertise in emergency preparedness.
Which is kind of shocking, right? Because surveyors are supposed to be the ones verifying that we're prepared for disasters, yet the report says some of them aren't even trained to evaluate our plans effectively.
Exactly. The OIG found that some survey agencies didn't consult emergency preparedness professionals, didn't provide regular training for their staff, and in some cases didn't even have access to emergency experts.
And that's a problem because it leaves gaps in accountability. Communities might assume their emergency plans are solid if surveyors don't flag anything, but if the reviewers aren't qualified, those gaps can go unnoticed until a real crisis hits.
The article in McKnight's also suggests some solutions. The big one? Encouraging partnerships. Facilities can collaborate with local emergency management agencies and public health departments to strengthen their own preparedness plans.
And I love that idea. It's proactive. It builds local relationships. And it ensures we're not just passing surveys, we're actually ready for hurricanes, power outages, pandemics, whatever comes our way.
Plus, it's a good reminder that survey compliance isn't the only goal. Real emergency readiness takes team drills, staff education, and regular reviews, not just checking a box once a year.
Exactly. And with more extreme weather events and public health threats on the rise, the stakes are higher than ever.
So even if your last survey didn't raise any red flags, this article is a call to double-check your plans, reconnect with local emergency partners, and make sure your team is truly ready.
Great reporting from McKnight's. And a strong reminder that we're ultimately responsible for our residents' safety when it matters most.
So this next one comes from the AJIC Science into Practice podcast, and it dives into something we've all wrestled with. How much infection prevention staffing is really enough?
Right, the episode focuses on the APIC staffing calculator. This tool designed by the Association for Professionals in Infection Control and Epidemiology. And it's more than just a formula. It's a whole rethink of how we allocate resources.
Exactly. The podcast explains that the traditional approach, like assigning one infection preventionist per facility or per number of beds, doesn't really reflect the complexity of care today.
Especially in senior living. You've got varying acuity levels, shared spaces, multiple vendors and visitors. It's not a one-size-fits-all scenario anymore.
And that's what the APIC calculator tries to capture. It factors in the number of residents, the intensity of services, the structure of the building, even how many isolation cases you typically manage.
The goal is to give communities a realistic, data-driven baseline for how many infection prevention hours are actually needed, not just what the regs say.
And that's huge because understaffing infection control has consequences. The podcast points out that lapses in prevention don't always show up right away. But when they do, they hit hard, especially in settings with vulnerable populations.
The episode also touched on leadership buy-in. It's not enough for an IP to raise concerns. They need administrators and directors of nursing who are willing to look at the data and shift resources.
Right. Because when infection prevention is seen as a cost center instead of a core function, it's easy to deprioritize it until something goes wrong.
But when you get it right, when staffing reflects the real workload, you see fewer outbreaks, better survey results, and a stronger culture of safety.
So if you're still working off outdated staffing assumptions, it's worth checking out the APIC calculator. The AJIC podcast does a great job explaining how it works and why it matters.
Honestly, a must-listen for anyone involved in care planning or resource allocation.
All right, let's turn to something a bit more clinical. There was a recent piece in Mayo Clinic Proceedings that really zeroed in on something we might be overlooking: how insulin injections are being done in our communities.
Yeah, it's all about the FITTER initiative, short for Forum for Injection Technique and Therapy Expert Recommendations. And according to the article, improper insulin injection technique is still way too common.
Exactly. The research shows that poor injection habits, like reusing needles, injecting into the same site repeatedly, or not using the right angle, can lead to complications like lipohypertrophy, poor absorption, and ultimately unstable blood sugars.
And that's a big deal in senior living. Many of our residents are managing diabetes, and for those who require insulin, technique really matters. It's not just a nursing task, it's a clinical procedure that affects outcomes.
The Mayo Clinic article pushes for better education, both for staff and for residents who self-inject. The FITTER recommendations emphasize things like rotating injection sites, using shorter needles, and disposing of needles after one use.
And they also recommend more training for caregivers, not just once, but on an ongoing basis, because habits can slip, especially when staffing is tight or routines get rushed.
Another key takeaway: we need better documentation and monitoring of injection sites. If a resident's glucose levels are fluctuating, we shouldn't just adjust the insulin. We should look at how it's being delivered.
Right. And I appreciated that the article framed this as a low-cost, high-impact area for improvement. It doesn't take a huge investment to train staff, but the benefits can be significant in terms of stability and resident comfort.
And even from a survey perspective, showing that your team follows evidence-based practices for insulin administration is a big plus.
If you haven't read it, the article in Mayo Clinic Proceedings is titled Advanced Insulin Injection Technique and Education with FITTER. It's worth reviewing and maybe even sharing at your next clinical in-service.
Definitely. Sometimes the smallest tweaks make the biggest difference, and insulin technique is one of those areas.
All right, to wrap up this week's episode, let's talk about something super practical, but often overlooked: medication packaging and handling.
Yeah, PharMerica just released their 2025 Unit of Use Product Guide. And while it might sound like a reference manual, it's actually a goldmine for frontline care teams.
Totally. The guide breaks down exactly how to store, administer, and dispose of some of the most commonly used medications in senior living. Think insulin pens, inhalers, eye drops, even topicals.
And it's not just product listings. It includes clear, color-coded instructions, like whether something should be refrigerated, how long it lasts after opening, and when it needs to be discarded.
Which is huge because, let's be honest, between new hires, agency staff, and shift changes, things like discard dates or proper storage can easily get missed.
And those small misses can lead to big problems: reduced effectiveness, resident harm, or even citations during surveys. This guide helps eliminate the guesswork.
One thing I really liked: the format is super user-friendly. You can print it out, post it at the med cart, or use it during staff training.
Exactly. And it supports best practices in MedPass, too. If a nurse isn't sure how long an opened insulin pen is good for, they've got the answer right there.
The guide also reinforces one of the bigger themes we've seen all year: investing in the basics. When your team has the right information at their fingertips, they're more confident and more accurate.
So if you haven't downloaded it yet, go to PharMerica's website and grab the 2025 Unit of Use Product Guide. It's one of those small tools that can make a big difference in resident care and survey readiness.
Great resource to close out the episode. Sometimes good care starts with clear instructions.
Thanks for tuning into this week's episode of HealthCap Weekly Wrap.
From legislative changes and quality measures to infection prevention and insulin technique, we covered a lot of ground, all with one goal in mind: helping you deliver better care and support in your senior living community.
If you'd like to dive deeper into any of the stories we discussed, you can find more details in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
We'll be back next week with more insights, tools, and conversations that matter to senior living professionals. Until then, take care, and thank you for everything you do for the residents in your care.